Hi, my name is Laura Gleeson. I'm an associate professor in clinical medicine here in St. James's Hospital, and I also work as a respiratory physician in St. James's Hospital. So my research focuses primarily on the immune response to tuberculosis, and specifically looking at the metabolism of the first immune cell that encounters the TB bug, which is called the macrophage. That's what I focused on during my PhD research, which I undertook about 7 years ago here in St. James's Hospital in the Trinity Translational Medicine Institute. And during that work, I was able to demonstrate a critical role for the way the macrophage uses glucose that it takes into the cell, and how the way it uses glucose impacts upon its ability to kill TB. So at present, I am working on looking at how different types of macrophages that are present in the human lung can act differently in terms of their metabolism and how that affects their ability to kill TB. Well, my day can be very varied because, as well as working as a researcher, I am also working clinically in the hospital, and I also am involved with the medical school teaching of our medical students who are training to be clinicians. So one thing I love about my role is that there is a lot of variety in it. It can involve coming in for a ward round at 8 o'clock in the morning, meeting patients who came in overnight through the A&E. It can involve doing procedures on patients in the hospital, or it can involve going down to the lab and meeting with my research team and discussing what we're going to do next, using patient samples to try and answer these questions that are important scientifically and will help us figure out the treatments of tomorrow. I think my favorite thing about being a researcher is being able to follow my own curiosity and use my own creativity and imagination to answer questions that haven't even been asked yet. And what I love about working in the School of Medicine, and particularly in the Trinity Translational Medicine Institute, is working with so many talented scientists who've had a different type of training from myself and who bring this totally different perspective and experience in this really collaborative environment.